My name is Jana Manglonia, and I'm doing my leadership analysis on Sylvia Burwell, who has been the Secretary of Health and Human Services since 2014. She was a former president of the Global Development Program of the Bill and Melinda Gates Foundation. While there, her program focused on combating world poverty. On April 11, 2014, Obama nominated Burwell to be the next Secretary of the Department of Health and Human Services, succeeding Kathleen Sebelius, and she was confirmed. She was born and raised in Hinton, West Virginia. Her mother was a former Hinton mayor, and her father is a retired optometrist. Secretary Burwell received a bachelor's degree in government from Harvard in '87 and a bachelor's degree in philosophy, politics, and economics from Oxford University, where she was a Rhodes Scholar. Her tenure as HHS Secretary coincided with the second open enrollment period for healthcare insurance, and Secretary Burwell faced off with reporters with questions about the federal government response to the Ebola virus disease and the enrollment for the PPA. Most recently, Secretary Burwell championed the fight against opioid addiction and joined forces with West Virginia Governor Earl Ray Tomblin to address the epidemic in our home state of West Virginia, which has the highest rate of drug overdose deaths in the entire nation. She stated that she has watched this epidemic cast a shadow over the communities that raised us, and that they are committed to fighting back against substance abuse and offering a road to recovery for so many families in West Virginia and across the country. She offered that curbing this epidemic required coordinated responses among the local, state, federal leaders, as well as healthcare providers, local organizations, communities, and families. Burwell noted that the Governor's Advisory Council on Substance Abuse and its 6 regional substance abuse task forces were meeting to address the needs of individual communities as well as those statewide concerns. In August in Washington, D.C., HHS brought together leaders from every state across the country for 2 days to develop regional strategies and share the best ideas in fighting opioid abuse and overdoses. Together, we need to respond to every angle of the epidemic, she said, from prevention to intervention and from treatment to recovery. This starts with making sure that opioids are prescribed responsibly. So in response to that, in 2012, the West Virginia legislature passed legislation that closely tracked how providers provide and prescribe opioids and mandated training for prescribers. HHS is working on a set of guidelines at this time for physicians focused on prescribing opioids for chronic pain and have developed a number of training programs aimed at improving the safe and appropriate prescribing of opioids. Burwell planned to work with other governors, Congress, families, and the medical community to make prescriber education a nationwide priority. Many face the threat of a deadly overdose, and in those moments, a nearby healthcare professional, law enforcement officer, or family member can save a life with the drug naloxone, which can reverse an opioid overdose. The governor's 2015 State of the State address in January urged West Virginia lawmakers to pass a bill to expand the supply of naloxone. Since this bill was signed into law, federal partners have awarded grants to support community partnerships that expand the reach of this medication. To truly tackle the opioid epidemic, Burwell appealed to all West Virginians to join with her in working with the families and communities to raise awareness of the dangers of prescription opioids and heroin use. Secretary Burwell exhibits many valued leadership traits such as emotional stability, enthusiasm, conscientious, self-confidence, team-oriented, communicates well, and empathizes. In many live interviews and speeches, she has shown that she is able to tolerate frustration and stress. She is expressive, energetic, and optimistic in a need for change. She exhibits a strong sense of duty and loyalty to her home state, which has currently experienced the highest rate of opioid-related deaths, as I mentioned earlier. Her approach to the dilemma is targeted and logical, and she seems self-confident in her approach. She seems motivated and prepared to lead West Virginians in a new direction and convincing in the need to do so. In her meeting with HHS on September 17, 2015, she emphasized a team approach in helping remedy the opioid epidemic, with collaboration with the National Association of Alcohol and Substance Abuse Directors, the NGA, and the Association of State and Territories Health Officials. Burwell displays innovation in recruiting help in the battle against opioid addiction through soliciting the recommendations from each of the governors, and they all responded. Burwell notes that she is committed to work together to share the best ideas in addressing this drug epidemic. Secretary Burwell has good leadership skills, solid leadership skills, which were clearly recognized by the Obama administration, resulting in her current appointment. Thank you.